And now I'll go ahead and turn it over to our presenters for the day.
Thank you, Allie. I just wanted to thank everybody for joining us today, and a brief introduction. My name is Melinda Baker. I am with the state of Indiana, the Office of Medicaid Policy and Planning. With me today is also Scott Runner. He is also with OMPP, and Kathleen Leonard will be joining us as well. She is also with OMPP, and Barry Bingaman with Myers and Stauffer. Today's topic is the FQHC wrap automation overview. At points during the presentation, I will pause on some of the sections to allow for the opportunity for questions. I know that we're limited on time, but I wanted to make everybody have, at least some opportunity to ask some questions in between. So today we're going to be discussing the wrap automation project. In short, this project was created to help you receive your wrap payments much faster than you do with the current process. We're aware that not all providers currently submit manual wrap request forms, but for those that do, this process usually involves running reports before submitting the wrap form to ensure that you're capturing all of your paid claims. With that being said, you might be wondering exactly how this wrap automation will benefit you. Beginning on July the 1st, 2021, every claim that you submit will have a wrap payment automatically calculated and sent to your facility. This process will move at a much faster pace than you're currently experiencing. Also, you will eventually no longer need to submit wrap request forms, and the need for the year-end reconciliations will also go away. This will eliminate the need to collect ad hoc data from the MCEs. So I'm going to go ahead and pause here just to see if anybody might have some initial questions. Are there any questions in the chat, Allie? Okay, let's go ahead and walk through the wrap payments and how they're currently processed. So just as a reminder, fee-for-service claims are currently paid at the PPS rate, and nothing is going to change for them. MCE claims are currently paid at the negotiated fee schedule. Providers request wrap payments by submitting a form to Myers and Stauffer, and the wrap is then calculated based on that request form and sent to the provider. The year-end reconciliation process is meant to capture any differences between the wrap requests and the final claims data. Let's see what that process looks like. This flow diagram shows what the current process looks like and the time that it currently takes to complete, as well as what the proposed time will be afterwards. So as you can see, the current process, the services are performed, claims are submitted to the MCE, claims are paid by the MCE, then you receive your paid claims report, or you prepare that and you send it off to Myers and Stauffer for approval, and then your payment is processed. On a good case scenario, it might take 7 weeks for you to receive your money, but on average, it's about 12 weeks. But with this new process, your services will be performed, your claims will be paid by or submitted to the MCE and then paid, and that data will be sent to Gainwell, and then Gainwell will process that wrap payment. So we're estimating that to take about 5 weeks. So as you can see, the time to process has decreased significantly. Are there any questions at this time?
There is a question in the chat.
Oh, what is it?
Are only traditional Medicaid plans included in the RHC payments? And this is from Sheila Rushton.
Traditional Medicaid, meaning standard Medicaid, or?
I'm going to take a stab at answering here, Sheila, and then you can let me know if I didn't answer your question. So currently, fee-for-service, what's usually referred to as traditional Medicaid, is already processed through the Gainwell system, and they pay you at your PPS rate. This RAP process that is changing is only applicable to your managed care claims that are submitted to Anthem, MedWise, MHS, CareSource, and recently United Healthcare. And so the current process would be you submit the claim to the MCE, they pay you at a fee schedule, their fee schedule, and then you can request RAP once a month to wrap you up to your PPS rate. And so that is the process that's changing. The MCE will still continue to pay you based on their fee schedule, but an encounter claim or a shadow claim will be submitted through the state system, and the state will automatically calculate RAP for the claim, each claim that comes through, if it's an eligible encounter.
Thank you, Barry. Were there any more questions? Okay. As you know, the reconciliation process is done every year. The current process compares the RAP request sent to the provider and the claims data provided by the MCEs. The settlement amount is what that difference is. So one of the biggest challenges that we faced has been the quality of the ad hoc data that on those reports that are sent to the MCEs. But after automation, that process will no longer be required. As you can see here, we are eliminating those steps. Are there any questions about this process?
Sheila submitted a follow-up clarifying question.
Okay.
Does this include the HMO plans, MedWise HIP, for example? So yes, Sheila, we are talking about the managed care plans. So MedWise for HIP, Hoosier HealthWise and Hoosier Care Connect, Anthem, same programs, MHS, CareSource, United Healthcare. So we're talking about Hoosier Care Connect claims, Hoosier HealthWise claims, and HIP that are submitted to the managed care entities.
Thank you, Barry. If there are no more questions, I'll go ahead and move on. So one of the big changes that we'll see with the automation project is that the way that you bill these claims. So beginning on July 1st, 2021, all the claims that you submit, medical and behavioral health claims, will be submitted with the T1015 so that you can receive your RAP payment. For any encounters that you have that are on the same date of service, that are of different scope and nature, you'll still bill those, but you'll do them separately as you do now, using the T1015 code as well, and a different primary diagnosis code. If for some reason you happen to leave the T1015 code off of the claim and you discover that lately, it's not a big deal. You just simply void out that original claim and resubmit it with the T1015. You also want to make sure that you are using the provider ID on the claim that is associated with your RHC enrollment. If you don't have that same a provider ID on there, you might risk the chance of not receiving your RAP payment. Do you have any questions about this process? Okay. Well, the dental claims will also be handled in a similar manner. The dental RAP automation project is in process right now with a target date for implementation of August the 1st. Now, what that means is that although they are not going to turn the button on until August 1st, we're actually beginning with the claims that start July 1st, 2021. Gainwell Technologies will reprocess those claims with dates of service on or after July the 1st, once they hit the go live button. So like your medical and behavioral health claims, the dental claims will also require a specific code to receive your RAP payment. We're going to be using the D9999 code for all dental claims so that you can receive your RAP payment. So please remember to put this code on all dental claims beginning July the 1st, 2021.
I would like to
Oh, go ahead, Barry.
I'd just like to clarify that this is going to be tied to dates of service, not just for dental, but for the medical and behavioral health claims as well. So it has to have a date of service of 7/1/21. That's going to be the trigger that the system will process it. So anything prior to will be handled in the old system. And I'm sure Melinda's getting to that, but I just wanted, while we were on this slide, to emphasize that it's for dates of service beginning July 1st and after.
Yes, thank you, Barry. On the dental claims, processing the global dental claims will not change. So these are the services that require more than one visit to complete, which would be like, crowns or dentures. This process that is used now will stay the same. So you will still need to have that D9999 code on those claims. But as a reminder, it's also beneficial for your facility to respond to any requests that Myers and Stauffer would send to you regarding these global dental encounters. It's a revenue opportunity for you. Do you have any questions regarding these?
We do have another question in the chat.
Okay.
From Daryl Watson, should we use the T1015 with a zero charge in conjunction with the E&M codes billed on the claim?
Scott, do you want to take that?
You can put zero. What the MCEs have been requested to do is just pay it at zero. So if you put any amount there other than zero, you'll just have to know that when it gets to the MCEs, it's just going to pay at zero when you see your EOBs from the MCEs. So it's really at the provider discretion at what they want to put there, but the MCEs have been instructed to only pay it at zero.
Thanks, Scott. Were there any other questions?
Not right now.
All right, thank you. Okay, as part of the automation process, you'll be seeing some other changes. On beginning with dates of service July 1, 2021, and that's the automation date, you'll begin requesting RAP payments on a new RAP form, which is going to be supplied by Myers and Stauffer. The number of claims and encounters reported on these manual RAP request forms will be going down from month to month. And by the end of the year, we expect the submission of these manual request forms to end. So as you can see by this sample right here, it's laid out that it has Anthem. It's broken down by your MCE and the dates of service here, which also includes your dental. So you'll be able to track those a little easier. Do you have any other questions as far as the form? No? Okay. Another benefit to the automation is new reporting. Gainwell has created a way for the system to track RAP payments and adjustments. So beginning with the automation, when you receive your remittance advices, you'll also receive a RAP report if a RAP payment has been triggered. And the report looks like this. So as you can see, the field should be easy to understand and will provide you with information that you need to reconcile your accounts. So at the top of the report right here, you see the reporting period. So this gives you your date span. Over here, you have your provider ID. And as you can see, this report is broken down and grouped by different provider IDs. So this is very helpful if you have more than one location for your RHC, then it will break down all the payments by each one of your IDs. In this section is your bones to the report. You have your claim ID, your member RID number. This is your MCE ID, so it will be broken down by Anthem, CareSource, UHC, MedWise. You also have your from dates of service, your to dates of service, the amount that you billed. And then right here, there's a current project going on that will insert the sum of all payers. So that will be what you were paid by the MCE and any TPL. And then you have your wraparound payment in this column. If there were any recoupments, you will see that here as well. Here's your expenditure ID and the accounts receivable and number associated with that transaction. Are there any questions?
I don't have any questions from the community right now.
Okay, awesome, thank you. Another area that affects the RAP payments is updating of valid and down encounter codes every year. So currently, when encounter codes are updated, the changes are submitted to Gainwell, and then Gainwell adjusts the claims once the changes have been completed in their system. Typically, the differences are captured in the year-end reconciliation process. However, after automation, any changes to the RAP will be captured when the claims are adjusted. Does anyone have a question about this process?
No questions.
Okay. Well, in closing on this presentation part, I just wanted to add that we've noticed that some providers have not reported CareSource or United Healthcare claims on their RAP requests. Now, we don't really expect to see a whole lot of United Healthcare right now because they just joined us on April the 1st. But in the past, we've noticed that CareSource has been left off. And we just wanted to remind providers that it's very beneficial for you to include those on your RAP request form if you have those kind of claims, because it's a cash flow opportunity. And another reminder, we just want to remind everybody that the changes in how your claims are submitted is very important. It's the key to receiving your RAP payments after this automation. All right. Do you guys have any questions?
Yes, another question from Daryl. Will we continue to receive back payments if we are not manually reporting MCE payments? So up until dates of service 7/1/2021, you can submit RAP requests for dates of service prior to, and you'll continue to get supplemental payments if you request those. And the year-end reconciliations will continue up for dates of service through 6/30/21. Does that answer your question, Daryl?
Hey, Barry, this is Kathy and Leonard. I just want to clarify though, but it sounds like if there's a provider that is not requesting any payments now, they will get them upon settlement. But since we are going to be eliminating the settlements, we really need them to go to this new automated process and be flagging the claims, because otherwise there's not going to be any reconciliation to catch them down the road.
That's correct. Come 7/1, they need to bill with the T1015 to the MCE, and the system will be responsible for making the payments, and there will be no reconciliation for dates of service after 7/1/2021, except for rare instances such as if there was a change in scope of service request, let's say, or a final PPS rate was set and it's retroactive, there might be manual intervention in those cases.
Thanks, Barry. Thanks, Kathy. Do we have any other questions? If not, we do have a frequently asked question sheet that we've had questions posed to us in past presentations that we'd happy to share here and discuss with everyone.
No additional questions in the chat at this time.
Okay. Some of the questions that we've been asked, like for the automation process, is when is the RAP automation going to start? So effective July 1st, 2021, the core system will go live with this and be able to process RAP payments automatically with dates of service beginning July 1 and after. And the same will apply for the dental on that too, since we've been given that update. Even though it will not actually go live until August the 1st, I was told by Gainwell today that they will capture the July 1st dates of service and reprocess those claims accordingly. So like I said in the presentation, it's important to make sure that you have the specific codes on there for both the medical and the dental to make sure that when they do reprocess those claims that they are captured. Has any testing been conducted to ensure cash flow to the FQHCs is not negatively impacted? Well, while there has not been any cash flow testing, it is believed that the process will speed up the current cash flow. Does the automation process include dental? Yes, as we just discussed a little bit ago, the dental implementation, even though it says July 1st here, is actually August 1st when they will go live, but we are going to use those dates of service July 1 and after. So in the case where there's a retroactive PPS rate increase due to the change in scope of service, will these go through the automated RAP process? For PPS rate increases that have dates of service before July 1, 2021, the current manual process will be used for the RAP process. Nothing is really going to change for that, but anything after July 1, 2021 will fall under the automated process. The T1015 code, can more than one claim be filed using the T1015 code? Yes, a separate claim must be filed and must have the T1015 code. Also has to have be of separate nature and scope and have a different primary diagnosis code if it's a second eligible encounter. And what if we leave it off of the claim? Well, yeah, like I said earlier, if you happen to notice that you left it off the claim, it's not really a big deal. Just simply void out that original claim and resubmit it. If it happens to fall after that 180-day window, reach out to the reimbursement mailbox and we'll see what we can do to help you on that.
Is the reimbursement mailbox email?
It's posted on the IHCP website, but I can share it when I send the copy of the slide presentation.
Good.
So that that way anybody can reach out if they have any questions. And will there be a deadline for the MCs to have their systems ready for the change? They have been ready for some time. When this project first started, I believe Scott talked to all the MCEs and they've been ready to go since at least the beginning of this year, if I'm not mistaken. And this question was answered a little bit earlier about the T1015 code. The MCEs will pay at zero, so it really doesn't matter what you put on the claim. They'll still pay at zero for the T1015. What is the timing expected for the RAP payments? We anticipate that it probably won't take more than 5 weeks for the payments to process because remember, it has to go through the claims process first. And then that report is sent to Gainwell and then Gainwell will process the RAP payment. So that may take at least 5 weeks. And does this mean that RAP payments will be identified for each patient so that the payments can be posted directly? Yes. That RAP report that I showed you will identify the patient using the Medicaid recipient ID number. So you should be able to match that up with your records easily. And one of the other questions that was asked before was, will the RAP payment be included at the claim level or the PLB segment on the remittance advice? So yeah, the RAP report is divided by clinic billing provider. So it will show the RAP payment at the provider level and at the claim level. So you should be able to see both those because it will divide it by the provider ID and it will list the claim itself with the recipient ID. Are there penalties for the MCEs if they don't relay the data timely? There's a statement of work that requires the MCEs meet certain timeliness requirements. So I don't foresee any issues with that information being transmitted other than timely. And then on the RAP report, where does the report show original payment amount? And will it show billed and RAP payment? We are currently working on that project to add what the MCE paid. So it'll be the sum of all payers when it comes across on that RAP report. And that will include the MCE payment and the TPL. Will the RID and the MCE identification numbers be on the RAP report? The RID number will be listed on the RAP report, and the MCE identification field that's on there is associated with the MCE. So it's, you know, whoever that belongs to, Anthem, CareSource, United Healthcare, and so on. Can FQHCs or RHCs request other fields on the remittance advice? We're open to feedback for the RAP reports. Just know that anything that's not already listed on there could take a while for it to go through the process of change if it's something that Gainwell can do. Will the RAP be available via 835? The RAP will be included as part of your remittance advice. So however you submit your claims and receive your remittance advice, it'll be included as part of your RA. And the reconciliation process. If the RAP settlement and reconciliation process must stay, why would a reconciliation process be necessary if it is 100% handled by the MCEs and Myers and Stauffer? The year-end reconciliation process will only continue until all years through 2021 have been reconciled. For years after 2021, we would not expect a reconciliation to continue. Barry, would you see any reason why we would need to have a reconciliation after that?
Not in the traditional sense, no.
Okay, I wouldn't think so either. And then other questions. MCEs in other states pay the PPS rate directly to FQHCs and RHCs. Why can't this be done in Indiana? Well, due to the complexity of our encounter calculations for FQHCs and RHCs, the MCE systems cannot currently support paying the PPS rate directly. And then one of the last questions was, when will Anthem have to start using the Medicaid RID number on their remittance advices? I know that I have checked with this question regarding this, and the Hoosier Care Connect was supposed to start on 4/1/2021, adding the Medicaid RID to the member ID to their card. So I was told that this would translate over to any claims data and remittance advice. So it should come back over when they send their remittance advice to you guys. It should have the Medicaid RID on there as well as the Anthem ID. We're still waiting for an answer back as to how this affects HIP and Hoosier Health-wise. We've not gotten that yet, but as soon as we have that, we'll be able to answer that question. Were there any other questions that we might have missed?
We have a question from Drew Thomas. Are you able to add the FAQ, our request to add Anthem's YRK to the RAP request report?
What is the YRK?
It's Anthem's internal MCE number. So Drew's asking if Anthem's recipient ID number can be added to the report being populated by Gainwell.
I do not know the answer to that question, but we can take that back for sure and find out that question. Will you guys be able to send me a list of questions that are in the chat? So if there's anything that we did not already address that I can address and send later.
Yeah, so I think we've answered most of them live, but
Right.
you know, obviously we're recording this session and I'm not sure, frankly, I've never tried to get a transcript of the question and answer portion. I know I can get a transcript of the chat, but right now everything's come in through Q&A.
Okay.
We just got a question that said this presentation does not relate to Indiana. Is that correct? And no, this is all related to Indiana. So I'm not sure if we're understanding the question.
Amy, did you want to expand on your question? Well, if we want to go ahead with some other questions, if anybody adds to that one, I believe what they were saying was they thought that Indiana did not need to follow these rules, but they do need to follow this new process.
That's correct. These are processes for Indiana Medicaid claims. I guess the thing that's going to be done the normal way or wouldn't have a change would be anything done under the fee for service or traditional plan that already has an automated process. So it's for Indiana managed care.
Anybody have any other questions?
There aren't any additional questions in the chat right now. Takes a while to type though, so
I know.
give them a couple more minutes.
And Melinda, what we can do is we can send out both the PowerPoint and the Q&A document along with our reimbursement mailbox address. So to the extent other questions come up
Okay.
after people review this, or if someone isn't on and they see the recording, then they will know where to reach out to us.
Yes.
Okay, I think we can wrap up then. That was all we had to present for today. But want to thank everyone for your time and your engagement. And again, if you have any follow-up questions for us down the road, please feel free to reach out and we will make sure to get everyone prepared for this change.
Thank you guys so much for your time today. Our 4 presenters, especially, this is very valuable information. And again, this is being recorded. We will have it on our YouTube channel by the end of the week. And then of course you can follow up with the website. And I believe they'll be sending me the slides. So we'll send that out to all registrants as well. So thank you, everybody.
Thank you, everyone.
Thank you.